Hello, I'm Dr. Karim Kurji, York Region's Medical Officer of Health. Our downward trajectory of cases seems to have hit a pause button. When we look more carefully, it appears that the larger number of cases can be attributed to outbreaks in long-term care homes that have still not come under control. In addition, we are seeing an upswing in the number of outbreaks in workplace settings, the number now having gone to over 40. We have produced a toolkit for businesses that is accessible from our website york.ca/COVID-19. This toolkit contains a lot of public health resources that give details on infection prevention and control, as well as other resources that businesses would find particularly useful. I was very pleased to read a report in The Lancet of May 22nd about the first phase of a trial in the development of a vaccine. The scientists have genetically engineered a non-replicating adenovirus with spikes on it. These spikes are identical to the spikes on the COVID-19 virus, and they have provoked a sufficient enough immune response on volunteers, with only mild to moderate side effects. Of course, more trials have yet to be done, and there may be hurdles here. However, there are 7 other trials going on in the world with respect to the first phase, and these involve different platforms. Some involve messenger RNA, some involve nucleic acid platforms, and some involve variations of the adenovirus platform. This means that we may be closer to a vaccine than we thought earlier, and indeed this would be a game changer for all of us. I wish to remind you to continue physically distancing, to wash your hands frequently, wear masks where physical distancing is not possible, and of course, to seek out testing at the 3 assessment centers if you have any symptoms of COVID-19. As for asymptomatic individuals, that is people without any symptoms, we are proactively screening the congregate living spaces, and we are also asking some asymptomatic workers in worker-related outbreak situations to seek out testing. In addition, the province has loosened the criteria so that anyone who is a contact of a case, even though they may not exhibit symptoms, can access testing. I just want to remind these folks that if you happen to be a contact of a case, you still have to wait out the 14-day period, even though your test comes back as negative, as you could still develop symptoms within that 14-day period. Finally, this is Paramedic Services Week, and on behalf of the whole regional municipality of York, I wish to thank our paramedic colleagues for the tremendous amount of work that they have done in this COVID-19 response. Not only have they treated individuals with COVID-19 on the way to the hospitals, but they have also dived into many outbreak situations in homes to assist, and they have provided mobile testing for COVID-19 when we've needed it the most. So thank you from all of us. So do stay vigilant and stay safe. Thank you.